My name is Karan Rajan. I'm a fourth year medical student. The doctors have just asked me to quickly take a look at your heart and see how it's working. I'm going to be using this ECG machine to do that. Have you ever had one of these procedures done before?
Yeah, I think I have.
Okay, so I'm just going to quickly tell you a bit about what I'm going to do. I'm going to be measuring the electrical activity of your heart and see how it's working. And so I'm going to be attaching some of these sticky pads to various points in your chest, and then I'm going to be attaching some of these leads onto those pads as well. Procedure shouldn't take longer than 5 to 10 minutes, and it won't hurt at all. So have you got anything you'd like to ask me?
No, that seems fine.
Okay, and so just before I begin, I'm going to ask you to take your shirt off so you're bare above the waist. Would you like a chaperone for this?
No, it's fine, thank you.
Okay, and are you in any pain at the moment?
No pain.
Okay, so sorry, could I just confirm your full name and date of birth, please?
It's Tristan Brown, and it's the 26th of August, 1990.
Okay, so that will make you roughly how old?
21.
21, okay, cool. So I'm just going to get my equipment ready and wash my hands. If you'd like to get changed, I'll be with you in a moment. Would you like any help getting undressed?
No, that's fine.
Okay. When you're ready. Okay, so like I said, the procedure shouldn't take longer than 5 to 10 minutes. And for this, I'd like you to be as relaxed as possible, so just be as loose as possible. And just before I begin, has the nurse come and shaved your chest and your ankles? Yeah? Okay. And have you got any pre-existing conditions of your heart that I should know about? No, you haven't at all. Okay. So you're comfortable at the moment? Okay. So before we begin, I'm just going to quickly have a feel for the heartbeat. Okay. Okay. Okay, that's fine. So I'm going to begin by putting some of these sticky pads onto your chest. Again, if you do feel any discomfort at all, please let me know. Okay. I'm just going to put a couple in your legs and your hands as well. Okay. Okay, so just try to remain as still as possible so they don't come off. Okay. If you could just turn your hands out like that for me, that's great. Okay, just last one. Yeah, that's fine, thanks. Okay. So now I'm going to be placing some of these leads onto those pads, so if you could just bear with me for a moment. Cool, so I'm just going to carry on by putting these leads on. If you could just bear with me a moment. Try to remain as still as possible so these don't come off. So they tend to sometimes get tangled up, so I'll try and limit that as much as I can. Okay, that's great. Cool. Okay, so then these final 6, I'm just going to place them onto the chest ones. Okay, just last one. Okay, thank you very much. So at this moment, if you could just stay very still, I'm going to put in the correct figures into the machine. And can you just quickly confirm your full name and date of birth, please, so I can type it into the machine?
That's Tristan Brown,
Yep.
26th of August 1990.
That's great. Okay, and if you could just stay still. Okay, so sorry about that. So just make sure it's back on again. Okay, so just stay still for me. So just give it a moment while the machine reads out the readings. Okay, so we've got your readings here. So what I'll do, I'll pass this on to the doctor and he'll be able to go through this with you. And so right now I'm just going to quickly take off the leads. So I'm not going to keep you in this position any longer. Hope that wasn't too uncomfortable for you.
Fine, yeah.
Okay, so this might be quite painful. Please let me know if you do feel any pain at all. Just going to take off these pads and dispose them. Alright, thank you very much. Okay, so yeah, I've just left some swabs here if you just want to clean yourself quickly. That concludes this procedure. If you'd like to just get dressed now, and then I can leave you with the doctor and he'll be able to go through this reading with you. So if you take that with you to him, he'll be able to talk you through that.
Okay.
Well, thank you very much. Would you like any help getting changed?
No.
Okay, thank you very much. So that concludes our OSCE Station video on how to do an ECG. Thank you very much. Tune in next week.